A resident with dementia becomes angry when you try to help with dressing. What should you do first? A. Insist on completing the task quickly. B. Step back and allow time to calm down. C. Call for another staff member immediately. D. Raise your voice for attention. Answer: B. Giving the resident time to calm down respects their autonomy and prevents escalation, maintaining trust and dignity. When communicating with a cognitively impaired resident, the nurse aide should: A. Use long, detailed sentences. B. Ask multiple questions at once. C. Use short, simple statements. D. Speak loudly and fast. Answer: C. Short, direct sentences help residents with cognitive impairment process information without confusion. A resident with Alzheimer's keeps wandering toward the exit. The best approach is to: A. Restrain the resident for safety. B. Redirect them to a safe activity. C. Lock all doors to prevent exit. D. Shout to stop them. Answer: B. Redirection maintains safety while preserving dignity and avoiding the use of restraints. When a confused resident refuses a meal, the CNA should: A. Report and try again later. B. Force them to eat. C. Ignore the refusal. D. Replace with medication. Answer: A. Respecting refusal and attempting again later helps address the cause of refusal without violating autonomy. Which of the following promotes independence for a cognitively impaired resident? A. Completing all tasks for them. B. Encouraging them to do what they can. C. Ignoring their attempts. D. Correcting mistakes harshly. Answer: B. Allowing participation builds confidence, maintains skills, and supports dignity. A resident with dementia becomes tearful in the evening. This behavior is often known as: A. Morning confusion. B. Sundowning. C. Hallucination phase. D. Anxiety disorder. Answer: B. Sundowning refers to increased confusion or agitation in the late afternoon or evening among dementia patients. The best way to gain attention before speaking to a cognitively impaired resident is to: A. Shout their name from across the room. B. Touch their shoulder gently and make eye contact. C. Speak while they are facing away. D. Use hand gestures only. Answer: B. Gentle touch and eye contact establish connection, helping the resident focus on communication. When a resident with Alzheimer's accuses staff of stealing, the CNA should: A. Argue to prove innocence. B. Search the room immediately. C. Respond calmly and redirect. D. Ignore the accusation. Answer: C. Calm redirection prevents distress and avoids confrontation that could worsen confusion. To help prevent agitation during bathing, the CNA should: A. Rush through the process. B. Explain each step calmly. C. Avoid eye contact. D. Use cold water to speed up. Answer: B. Explaining each step reassures the resident and maintains comfort throughout care. When a confused resident becomes violent, the CNA's priority is to: A. Leave the room and call for help. B. Physically restrain immediately. C. Argue to calm them. D. Continue task regardless. Answer: A. Ensuring personal safety and getting assistance is the first action during aggressive behavior. Which memory is usually retained longest in dementia patients? A. Short-term. B. Recent. C. Long-term. D. Procedural. Answer: C. Long-term memories, particularly emotional or distant ones, tend to remain intact longer. Validation therapy helps by: A. Correcting incorrect statements. B. Arguing to reorient reality. C. Accepting feelings as real to the resident. D. Ignoring delusions. Answer: C. Validation therapy respects emotional experience rather than challenging factual errors. A resident insists they need to go home to feed the dog, though they live in a facility. The CNA should: A. Remind them they live there now. B. Tell them the dog has been taken away. C. Reassure and redirect to another topic. D. Laugh and ignore them. Answer: C. Redirection reduces anxiety and avoids confrontation about reality. The CNA notices a resident with dementia wearing multiple layers of clothing. What is the best response? A. Remove all layers without asking. B. Allow if comfortable and safe. C. Scold for inappropriate dressing. D. Report to family only. Answer: B. Dressing in layers is often comforting. Safety and temperature tolerance are main concerns. Which activity is best suited for mild cognitive impairment? A. Complex crossword puzzles. B. Folding towels. C. Advanced card games. D. Math tests. Answer: B. Simple, repetitive tasks provide structure and success without frustration. Which action shows respect for a confused resident's privacy? A. Talking about them with coworkers nearby. B. Discussing care at the nurse's station. C. Closing curtains during personal care. D. Leaving door open for supervision. Answer: C. Maintaining privacy promotes dignity even when cognitive awareness is limited. If a resident frequently forgets meal times, the CNA should: A. Scold for forgetfulness. B. Use a consistent routine and visual cues. C. Change meal times often. D. Ignore until hungry. Answer: B. Routines and cues help residents feel secure and reduce confusion. A cognitively impaired resident begins to wander at night. The CNA should: A. Use restraints. B. Provide a safe walking area. C. Lock the door. D. Administer sedatives. Answer: B. Allowing safe movement meets physical needs while preventing injury. When communicating with a resident who has word-finding difficulty, the CNA should: A. Interrupt and finish sentences. B. Wait patiently for response. C. Ask complex questions. D. Move on quickly. Answer: B. Patience reduces frustration and encourages communication efforts. A resident with dementia refuses medication, believing it is poison. The CNA should: A. Force them to take it. B. Report and try offering later. C. Hide the medication in food. D. Discard it quietly. Answer: B. Respect refusal, document, and reattempt under supervision or different approach. Which is an early sign of cognitive decline? A. Increased appetite. B. Repeatedly misplacing items. C. Improved sleep. D. Enhanced focus. Answer: B. Frequent misplacing of items signals short-term memory issues often seen early in decline. When a resident becomes disoriented after a nap, the CNA should: A. Calmly reorient using clocks and signs. B. Ignore the behavior. C. Tell them they are wrong. D. Use medication immediately. Answer: A. Environmental cues like clocks and calendars help gentle reorientation. Which approach is least effective for a confused resident? A. Consistent caregivers. B. Quiet environment. C. Multiple simultaneous instructions. D. Familiar routine. Answer: C. Multiple instructions overwhelm limited processing abilities, increasing confusion. A resident with cognitive impairment begins hoarding food. What should the CNA do? A. Remove items secretly. B. Understand behavior and ensure safety. C. Punish for rule violation. D. Ignore until infestation. Answer: B. Hoarding may reflect insecurity. Address safety while maintaining respect. When helping a resident with dementia eat, the CNA should: A. Serve one food at a time. B. Mix foods together. C. Rush to finish. D. Stand over them. Answer: A. Serving one food at a time minimizes confusion and supports independence. Which statement shows empathy for a confused resident who feels lost? A. You're wrong, this is your home now. B. Let's sit together while we find your room. C. You always forget your way. D. Ignore it, you'll remember soon. Answer, B. Empathy combines reassurance and companionship without confrontation. Which technique best reduces nighttime agitation? A. Keeping bright lights on. B. Providing a quiet, dim setting. C. Allowing caffeine drinks. D. Scheduling multiple naps. Answer, B. Calm, low-stimulus environments promote rest and reduce sundown agitation. When documenting care for a confused resident, the CNA should: A. Record only abnormal findings. B. Use objective, factual statements. C. Include personal opinions. D. Omit details. Answer, B. Objective documentation ensures clear communication and legal accuracy. If a cognitively impaired resident becomes sexually inappropriate, the CNA should: A. Scold them. B. Maintain professionalism and redirect. C. Leave the facility. D. Laugh to ease tension. Answer, B. Calm redirection preserves dignity for both resident and caregiver. The most effective way to support cognitive function is to: A. Provide structured, meaningful activities. B. Avoid mental stimulation. C. Limit interaction. D. Change routines frequently. Answer, A. Meaningful, familiar activities help maintain memory, attention, and emotional stability.